Now live from Whitney Media, 1460 WVOX, the Greenberg Report with Greenberg Town Supervisor Paul Feiner. You can join in the conversation at 914-636-0110. Now on 1460 WVOX, here's Greenberg Town Supervisor Paul Feiner.
Good morning, Westchester. My name's Paul Feiner. I'm the Greenberg Town Supervisor. The COVID-19 pandemic and resulting economic downturn has negatively affected many people's mental health, and it created new barriers for people already suffering from mental illness and substance abuse disorders. A poll recently found that 45% of adults in the United States reported that their mental health had been negatively impacted due to worry, stress over the virus, and as the pandemic wears on, it's likely that mental health burdens will increase because we're slowing the spread of the virus through isolation, social distancing, school and business closures, and shelter-in-place orders. And that creates a lot of stress. So my guests today are Sharon McCarthy and Marie Considine of NAMI and NAMI Westchester. And NAMI is a terrific organization that helps people overcome the challenges that they face during this type of crisis. So, Sharon and Marie, thank you for joining us. And maybe you could tell us a little bit about NAMI.
Sure, thanks. Good morning, Paul. This is Marie, and I want to thank you for having us today. Mental health is so important, and we appreciate the reliance that the town of Greenberg gives to NAMI Westchester. Our offices are right in Elmsford, part of the town, so we're happy to have you as our neighbor. So NAMI Westchester is a nonprofit organization. It was formed in 1983, and NAMI Westchester is an affiliate of the National Alliance on Mental Illness on both the state and national level.
And
so
what is... I'm sorry.
So this is Sharon. Our mission is to improve the quality of life for all individuals and families who are living with a mental illness and co-occurring disorders.
Right. Could you maybe speak just a little louder?
Okay.
It's great. And who do you serve? What programs do you work?
Serve families and adults living with a mental illness.
And you know, how many families do you help each year?
Well, our membership is over about almost 300, but, you know, through our helpline, we average about 100 calls a month.
Right. In terms of the helpline number, could you tell us what that phone number is?
It's 914-592-5458.
And is what times during the day is the helpline open?
So right now it's open from 9 to 5. We've extended the hours since our offices are closed, but we have the phone being forwarded to a number that can pick up from 9 to 5. Right.
Have you seen the mental health needs of people change over the years?
I think people are more aware than they have in the past, so we get more calls of people who are dealing with it and wanting the support and the help. More families are more aware now and realizing the importance of family support when somebody has a mental illness. So I think you see more people, but I think that's more because of the awareness that's out there.
Are you finding that during this crisis, more people have mental illness related concerns?
Certainly, anxiety is going to be more during a time like this because of the isolation that people are dealing with. And certainly people dealing with a mental illness, that can be very difficult to live with. And if you already have anxiety, this can certainly heighten it. I think the longer this goes on, I'm sure it will be affecting more and more people's mental health.
Right. Last week, I had representative of my sister's place, and we were talking about domestic abuses. Is that sort of a related mental health problem?
Well, we don't directly address that, but certainly, we get calls where you can, that is going on, and we will direct them to the services that can help them. And that is a big concern right now, the domestic abuse issue as well, with the mental health issues.
Right. Now, when people call you, what organizations do you usually refer people to?
Well, for mental health, we have a lot. We have Mental Health Association of Westchester, Human Development Services Westchester. Certainly, our county Department of Community Mental Health is
Now, back to the Greenberg Report on 1460 WVOX. Once again, here's Greenberg Town Supervisor Paul Feiner.
Good morning. I'm Paul Feiner. I'm the Greenberg Town Supervisor, and we're discussing today a very, very important subject, mental health. And mental health concerns are very, very it's an important part of this COVID-19 crisis, because as people are isolating, as they're losing money, the current financial crisis is creating mental health problems. We have substance abuse related concerns. So my guests today are Sharon McCarthy and Marie Considine of NAMI. And NAMI is an organization that helps people address the challenges of mental health. Could we start again by you telling people what the hotline number is?
It's 914-592-5458.
And you're open from 9 to 5. It's Monday through Friday?
Yes.
And if somebody has, say, concerns in the evening or on weekends, do you have suggestions who they should contact?
Well, they could call go into our website, because we have numbers and resource information on there of numbers that you can call after hours too.
What's the website?
NAMIWestchester.org.
Do you find that people who are experiencing job loss, does that increase depression, anxiety, distress, self-esteem, and is that one of the major concerns that people are experiencing during this crisis?
Certainly, those are going. And as I say, the longer this goes on, I think the more people are going to experience high levels of anxiety, go into depression, worrying about how they're going to support themselves, their families. This is all going to play into that. There is a phone number that New York State has established where you can talk to a mental health professional, which I encourage people to do. If they call us, I give them this number, because I think, these are the times when you should be talking to somebody if you're feeling those types of symptoms.
And I guess suicide prevention would probably also be a problem.
Oh, definitely, and which is another reason. If somebody's seeing any of these symptoms, and we have the symptoms up on our warning signs, they should be talking to somebody to help them get through this.
Right. So really what NAMI does is you're almost like a clearinghouse and can figure out what organizations people could reach out to get more assistance. Would that be accurate?
That's part of what we do. We do also we're running right now virtual support groups. So I can get, if somebody thinks that a support group would be helpful, we do have them. I'm looking into possibly bringing our educational programs online, virtual. Haven't done that yet, but we do have 2 great educational programs. And we do presentations, and I actually did a presentation virtually last night for a group. So we do a lot of community awareness and education as well.
That is great. How do you get your funding, and what's your budget?
We rely heavily on our annual walk, which normally takes place during May, which is Mental Health Awareness Month. So we normally do that at a very large park here in Westchester, and we have more than 600 people attend. So because of the changes due to COVID-19, we aren't able to gather at this time. But as has been stated, it's critically important right now to support mental health. So we did not consider cancellation. We've moved this community event to a virtual one. So it's called NAMI Walks Your Way. So that means that participants can get creative with their own personal event and fundraising. Some people are planning to do a yoga session. Some will do their own 5K in their neighborhood, all kinds of different things. People will host a gathering with friends. So the best way to support our organization is to do these kinds of things and do what's called peer-to-peer fundraising and awareness. Because when you share that you're passionate about mental health and passionate about the programs that NAMI Westchester offers and provides in the community, then that's a way of letting people know that we are here as a resource and as an educational organization, but also to support our program. So that's really where about 70% of our budget comes from. And we also have a small county contract and rely on membership as well. So you can become a member of NAMI Westchester, which when you become a member of our organization, you're also a member of NAMI at the higher levels too. We work very closely with NAMI New York State and NAMI National, and we work on advocacy issues together. We go to Albany and we have local meetings with legislators who are crafting laws that impact mental health.
Right. Are there any proposed laws that you're pushing right now for this legislative session?
You can go on our website and we'll direct you to NAMI New York State and their whole agenda for this year. There's a lot of issues. Of course, funding is one of the biggest ones. We need more funding. We need more beds. We need more housing. There's a lot of issues that we really are pushing, better funding, especially in terms of people getting their prescriptions and cost for their psychiatric services. A lot of insurances are dropping. People and psychiatrists and therapists are not taking insurance, so that has presented a great deal of problem to people. So these are issues that, NAMI is looking at and trying to get our legislatures to look at as well as how that we can resolve these.
So we have to take another break, and we'll be back in a couple minutes. I'm Paul Feiner, Greenberg Town Supervisor. We're talking about mental health issues in the age of COVID-19.
.1460 WVOX. Now back to the Greenberg Report on 1460 WVOX. Once again, here's Greenberg Town Supervisor Paul Feiner.
Good morning. I'm Paul Feiner. I'm the Greenberg Town Supervisor, and we have a very, very interesting program today with one of the best organizations in the county, NAMI of Westchester. And this organization provides very, very important services to those who have mental health issues. And as we talked during the show, this is a very difficult time for a lot of people. Many people have lost their jobs temporarily or permanently. Many people have seen their businesses forced to close down for weeks or months. and some of these businesses won't survive the crisis. People can't pay their taxes. They can't pay their rent if they're a business or if they're a tenant because they don't have the income. It's just a very, very difficult, time. And my guests are Sharon McCarthy and Marie Considine, and we're talking about the services that NAMI offers. And could you start again by just telling us the phone number and your website?
914-592-5458, and our website is NAMIWestchester.org.
And I guess, are you finding that a lot of people are also, just worried about paying their bills, and it's not only isolation, but they might not be able to pay their taxes and get stressed out. They may worry that they're going to be thrown out of their homes or lose their leases. Is that a concern?
That's certainly a concern. Most of the calls I'm getting, though, are really related to mental health issues. Mostly families are concerned about their individuals living with a mental health issue and how they're dealing with things right now, and making sure they can get their appointments. And, a lot of this is being done virtually now, and renewing prescriptions and things like that because it's so important. And then just seeing individuals with a mental health condition, seeing them declining and trying to get them into possibly a hospital or some kind of program to help them.
Is going into a hospital nerve-wracking because people are worried about going anywhere where they could interact with people during this type of crisis?
It definitely is a concern, and you have to weigh that concern. That's why, hopefully with the help of your psychiatrist or your therapist, you can make that determination and weigh, what is the best thing to do. And certainly hospitals are doing everything they can to assure the safety of individuals. But you really have to weigh it in a mental health situation, because if somebody's in a really deep depression and there's a potential suicide, you definitely need to get them hospitalized so that they can get the treatment and the observation that is needed.
Right. What's some of the changes in programs and services, including the importance for people to reach out to one another to prevent physical isolation?
Well, I know all the programs in Westchester, a lot of them have changed to doing virtual support groups and things like that, phone appointments, so they're doing everything they can to continue to reach out to everybody and their patients. I have to say, I haven't had anybody calling and saying that they've had difficulties in reaching, a psychiatrist or therapist, but all the organizations in Westchester are pretty much running programs, whether it be via phone or virtual. One of the programs HDSW has, the Living Room, which was a drop-in type program where people who were having difficulties could go, is still open, but they're limiting the amount of people, and they're screening them on the phone because they realize there are certain people who isolation could be very dangerous. So they're addressing that. Certainly, MHA is doing a lot of virtual support groups as well, like us. So there's Westchester Jewish Community Services and other programs that are doing a lot of their programs virtually so that they can keep people together and checking on each other.
Right. Let's say somebody doesn't want to admit that they have mental health, concerns, but family members are worried. Would they reach out to you? Is that an issue that sometimes comes up where people are in denial?
Certainly, you have that a lot. A lot of our family members who take our family course are in that course because of this issue. certainly, if you feel that the individual is a danger to themselves or others, you need to call 911 and get help. We also have in our county the Crisis Prevention and Response Team, who will certainly work with a family and an individual in hopes of getting that individual the help and the services they need. So, that's another avenue that families can often take that might be helpful in getting the individual to understand that, everybody's concerned for their well-being and just wants to get them help. But denial is a very big issue with mental health. To get somebody to understand that, getting the right treatment can make a big change in your life is very difficult when they're in the midst of their episodes.
Exactly. You were mentioning that you have different classes also?
Right. We have two kinds. There's the education class, two educations. One is family to family. That's an 8-week course for family members who are living with somebody with a mental illness. And that teaches them pretty much everything they need to know to help that individual. From, what the illness is, problem solving, communication skills, what recovery looks like, because we know recovery can happen, and help families understand that, as well as self-care for themselves. And then there's a program called Peer-to-Peer, which is for individuals who are in recovery, and it's a program geared to help them maintain that recovery, and that's 6 weeks. Right now, we're not running the programs. I am hoping that if we're not going to get back to where we can do a lot of in-person stuff, that we can look into doing these virtually.
Right. It's interesting because I was, before this program, doing a little research about, mental health issues, and I was really surprised that prior to this pandemic, there were reports that nearly 1 in 5 of United States adults reported having a mental illness in the past year. And, is that accurate, the numbers?
That's very accurate. And suicide is the second leading cause of death in the ages of 14 to 34 years of age. So those are two very startling figures. So it's very important for people to educate themselves on those warning signs, which we have up on our website, so that if they see these warning signs in an individual, that they act on it. Especially in a teen, you often may see things that you could take to mean, oh, that's just a typical teenage behavior, which really it may not be. It could be that teen is suffering from a mental health condition and you need to get them help.
Right. We have to take one more break, and then we'll be back and we'll talk about Mental Health Awareness Month.
And every other Wednesday at 5 p.m. on 1460 WVOX and WVOX.com.
1460 WVOX.
Now back to the Greenberg Report on 1460 WVOX. Once again, here's Greenberg Town Supervisor Paul Feiner.
Hi, I'm Paul Feiner. I'm the Greenberg Town Supervisor, and we're talking about mental health concerns with Sharon, McCarthy, and Marie Considine of NAMI, Westchester. And May is Mental Health Awareness Month. And the town of Greenberg has recognized the month normally with banners, this year with information and digital banner on our website. And could you tell us a little bit about the Mental Health Awareness Month activities and why this is important?
Okay, so in the past, we've had ribbons up, we've had banners up, we've had flag raisings and press conferences and all kinds of activities throughout the month of May. Unfortunately, due to the social distancing, all of that has pretty much had to come to a stop. So this year, we are encouraging different communities like yourself to put information up on their website. Westchester, White Plains is going to put it up on their digital boards like they have done in the past. We have an ad on all the county buses, so that's another way we're getting information out. We are going to do a virtual presentation, an In Our Own Voice presentation on May 7th to help educate the community on mental health awareness. So those are some of the things we're doing. And, of course, the walk is really on May 30th, the big thing, and so important, not only to our funding, but also as a way of giving out awareness on mental illness. And I encourage people to go to that website, which is namiwalks.org/Westchester, and see how they can get involved. And they certainly can call our office to find out how to get involved, or if they have difficulty registering, whatever, they can give her a call. But the walk has always been our big event for May, our biggest community awareness event, because that is where we've gotten, as Marie has said, over 600 people attend, and it's a great way to get the information out. And it certainly has shown those living with a mental health condition in our community how much our community really does support them. And I think that's really important. So I think being able to get in on that website, sign up. You can sign up as a walk or sign up with a team, but get in there and let people see, our community goes on that website. They see the amount of people that get involved, and it certainly makes them feel that the community is there for them. So I encourage people to get involved in any way they can.
That is, really, important. And again, if people have questions about mental illness, could you give us the hotline number again?
The hotline number is 914-592-5458. The hours are 9 to 5. You can leave a message on the voicemail after hours, and we get back to you right the very next day. So if somebody calls and wants information from NAMI itself, they can also call after 5 and leave a message.
And, it's really something that I really haven't thought of is this COVID-19 probably is having a major impact on fundraising. It's much harder to do virtual fundraising than, people are going to an event, and, some people go to fundraisers for networking purposes, and now they're not doing that. So has your fundraising been hurt, or?
Well, we certainly will see that after May 30th, because the walk has always been our major fundraiser. It's a majority of our budget. So we are really concerned about raising those funds, which is why NAMI, the national organization, has been great in helping us in terms of this virtual walk, in the hopes that we will still be able to raise funds. If not, we may be looking to do another fundraiser this year. We certainly count on events like Giving Tuesday also to raise funds. But the walk was the major one. And we are very, very concerned that we are not going to bring in the funds that we've brought in the past. And there's so many great organizations out there right now needing assistance, needing donations, that we're all competing with each other. And I understand that, and that's going to be part of the problem too. So,
and also, there's people who probably were big donors, and they don't have the money now because their businesses have shut down, or they lost money in the stock market, or they're just facing personal issues, which probably will hurt a lot of not-for-profits.
Without a doubt. And I think, we'll see some of it this year, but even more next year. Because next year, when we get ready to do our walk and we're looking for sponsors, we have over 30 sponsors right now. How many of those sponsors are going to have to come back to us next year and say, we just can't do it this year. We didn't make the money. We don't have the funds. We didn't make the money last year. So the impact on this is going to be long-term for all of us. Next year is going to be a very interesting year when you start to do events and look for sponsors, because I do think there's a lot of businesses out there that are going to be hurting and not be able to support the organizations that they have in the past because of this.
Right. So does a not-profit, Westchester organizations, do you meet and strategize together?
I'm sorry, could you repeat that?
Do you strategize with other not-for-profits as to the best ways of fundraising?
Yes, definitely. Well, Nonprofit Westchester we are a member of that organization. They have a lot of, webinars and events that can help us strategize and, help us with these issues. Actually sat on something last week that they sponsored about the Paycheck Protection Program that's out there and information about that. So they've been very, very helpful. And also, we look to other organizations to partner up to do things. New York Presbyterian, we partner with them every year to do a film event. Human Development Services of Westchester partners with us on quite a few of our events. Even when it comes to grants, sometimes we partner up with people in terms of grants in hopes of getting them. So we definitely work with a lot of organizations to try and work together to support each other with programs, but also financially.
Right. We have talked, during this program about suicide prevention. We've talked about stresses from job losses. Is drug overdose another part of mental health problems?
Well, drugs in general, we often say to families, if somebody is abusing drugs, they often are self-medicating. And that's why it's really important that we educate people on the fact that, mental health and drug abuse can often go hand in hand, and being treated for both is really important. Our county has a committee that actually addresses that issue and has done some great work in the past year in terms of getting agencies together on how do we address this issue and help individuals who are dealing with a mental health condition and drug abuse to ensure that they're getting the treatment to get better. This is a very, very big issue, and I do think we've made some headway with it. A lot more agencies out there are offering the co-occurring treatment plans that are so necessary.
Right. We're just have a couple seconds, left before the program ends, and I want to thank both of you, Sharon McCarthy and Marie Considine of NAMI Westchester, for your hard work and efforts and helping people overcome their mental health related problems. And could we again tell people the phone number they could reach if they have mental health concerns?
And that number is 914-592-5458. And our website is namiwestchester.org.
Thank you very much for joining us. And
You're
we
welcome.
really appreciate
Thank
your
you.
work.